My name is Jessica Lowy, and I am a 2011 graduate of Richmond Heights High School and Lakeland Community College. This summer, I had the pleasure of participating in the Science Internship Program for Nursing in Cardiovascular Medicine. The title of my research project is Correlation of Visualization of Atherosclerotic Plaque in the Subclavian Artery by Carotid Duplex Ultrasonography with Angiographic Measures of Vessel Stenosis. Some background. Atherosclerotic plaque is the residue that can form in the arteries. It consists of cholesterol, fat, calcium, and other substances found in blood. Atherosclerosis is the condition of this plaque forming, constricting the vessels and restricting blood flow throughout the body. When an organ does not get enough blood, it does not get enough oxygen. The subclavian arteries provide oxygen to the arms. Both of these arteries are found under the clavicle bones. However, the left subclavian branches directly off the aorta, while the right is one of two branches off the brachiocephalic or innominate artery, the other branch being the right common carotid artery. Doppler ultrasound is a method of imaging blood flow throughout an artery. On the screen, you can see a color impulsed wave Doppler of a normal left subclavian. There is no turbulence in the waveform. This image and the next were both taken from the same patient. Again, this is the image of the same left subclavian as the last. This image is an angiogram, or an X-ray taken while a contrast dye is injected through the vessels. Angiograms outline a vessel and indicate narrowings if present. Stenosis is the narrowing of a blood vessel. On the left, you see stenosis is detected by angio. This example has 47% blockage. On the right is the same subclavian artery as detected by ultrasound. The turbulence is the indication. My hypothesis is that there is a correlation between the amount of atherosclerotic plaque in the subclavian artery as determined by Doppler ultrasound and the amount of narrowing or stenosis is seen in angiograms. To conduct our research, we used a pre-existing database of all carotid duplex ultrasounds taken between January 1st and May 31st of 2011. We checked e-records to see which patients had cardiac caths or other angiographic procedures taken within 30 days of their CDU. Our exclusion factors were subclavian artery stents, prior subclavian artery surgeries, subclavian aneurysms, large vessel vasculitis, LVAD, ECMO, and IABP. We then used a semi-automated border detection program to determine the percent stenosis of the subclavian artery. Statistical software found the correlations. Our database consisted of 3,707 patients. 138 had angios taken within 30 days of their CDUs, with 3,569 without. But of those 138, 121 met all of our criteria, leaving only 17 having angios but meeting the exclusion factors. Of our 121 inclusions, 91 were men. Our average patient was 69.3 plus or minus 10 years old. 6 came in for asymptomatic cervical bruits, 2 came in for stroke or TIAs, 10 had had known carotid disease, 102, or 84.3%, were here for pre-op examinations. On ultrasound, 91.7% had internal carotid abnormalities. On ultrasound, 42% had right subclavian artery abnormalities. On ultrasound, 19.8% had left subclavian artery abnormalities. On angio, or the gold standard, 81.8% of all 11 checked for right subclavian arteries had abnormalities. 76% of the 117 checked had less subclavian abnormalities. I highlighted the data to compare the ultrasound to the angio. Our conclusions from our research were that atherosclerosis is common in those who present need for the subclavian artery for carotid duplex ultrasonography. The most common indication for CDUs at the Cleveland Clinic is preoperative examination. Carotid duplex ultrasonography detected internal carotid abnormalities in the majority of our patient sample, but ultrasound was less sensitive for detecting subclavian artery abnormalities when compared to angiographic procedures. Closer attention probably should be paid to the subclavian arteries when looking for plaque using ultrasound. Further studies should be conducted to compare the sensitivity of ultrasound for detecting plaque to that of ultrasonography. To conclude, I would like to thank all those who helped me this summer, especially Dr. Kim, Dr. Gornick, Ms. Sue Whitelaw, Ms. Sandy Yazanko, Ms. Miriam Khan, Mr. John Bennett, Mr. Adil Menon, and Niter Starling in the Office of Civic Education Initiatives. Thank you.